Hello, and thanks for coming to my video again. Seems like we're running out of things to talk about as far as video topics. But this week I wanted to speak a little bit about some of my career goals. So from an early age, I've always had an interest in social work, specifically the clinical side of social work. So just a little bit about my history. I started with the University of Maryland. I got a bachelor's in family science, which was the closest thing they had to social work. And then I began my master's here at the University of New England. During my work experience, I've worked as a bereavement coordinator. So I worked in the organ and tissue procurement industry, where I worked with families when someone was coming to their end of life, and helping them through the grieving process, as well as providing aftercare, but also facilitating the process of organ and tissue donation. So that was very interesting. I worked there for about 2 years, and I realized that's not what I want to be spending the rest of my life doing. Just because, I mean, there were so many benefits from it, and feeling rewarded working with the families through their grieving, but it was very heavy, and I took a lot of it home with me at night, so I kind of struggled with it in that aspect. And then most currently I work for a behavioral health company. We do case management, and that kind of sparked my interest in eventually wanting to do my own therapy in my own practice. That's of course very far down the road, about halfway done my MSW program, and then I'll eventually have to get my LCSW and go through all the process of, getting my license and all that. Specifically, I want to focus on anxiety disorders. I really have an interest in obsessive compulsion disorder. I actually have someone in my family who suffers from OCD, and that kind of got me onto the path of probably going to be focusing on that as I move through my therapy degree. So that's my main career goal. I'm looking for the next, let's say I'm 28 now, so I'm thinking the next 5 years I'll be finishing up my MSW program. I'll continue to work for the behavioral health company I'm working for now. I get great experience there. I'm spending 3 days a week in a behavioral health unit on a psychiatric hospital. So as far as wanting clinical exposure, I couldn't ask for anything more. So that's been going well. I'm definitely learning a lot. It's so interesting sitting in rounds with the other social workers and the psychiatrists there on the unit, and just hearing them talk about the clients as far as their diagnosis, their treatment plans, even like medication management. I find pretty fascinating. I'm learning like which medications work differently for different diagnoses. So it's all really interesting to me. I think it's going to be a great foundation for what I want to do long term, which is go into clinical social worker, eventually my own practice, or working for like someone else's small practice. I always had a desire to do like individual one-on-one therapy, maybe some like couples counseling, something about like working one-on-one with someone I've always been drawn to. I really admire people who love like the community setting, or advocacy work and all that. That's definitely something I am not as strong in. So that's a quick summary of my career goals. I know that as I move through my career, things can change. When I started, I knew I wanted to be in social work, but I didn't know which type of social worker I wanted to be, whether it was going to be like even like policy. I've had an interest in policy. So it started from that, and then it moved to, I was in the bereavement coordinator, so I thought maybe I'll be a grief counselor, and now it's shifted to wanting to be a clinical social worker, practicing OCD. So ways that I've kind of nurtured that thought of wanting to focus in OCD is, since realizing that, I've taken a lot of courses outside of the University of Maryland. There's the Beck Institute, which has a great like short-term CBT program. They also have some courses that focus specifically on OCD, so I have been finding them extremely helpful. My current employer pays for like continuing educational workshops, so I've had the opportunity to go to a couple different OCD workshops in the area, so that's been great. So I'm just gonna keep pushing down that route and see where it takes me. So thank you all.